Back in July, some 72% of you expressed an interest in seeing a documentary on doctors of osteopathic medicine, and specifically how they differ from medical doctors. And Lorrie Secrest has talked with several DOs, as well as their patients, and provided us with an in-depth report. So let's take a look at this.
Doctor's Hospital is like any other hospital with departments of surgery, pediatrics, an intensive care unit, and emergency room. But it differs in one respect. The physicians at Doctor's Hospital are doctors of osteopathic medicine, or DOs as they are called. We're going to examine the philosophy of DOs, learn how they differ from MDs, and how they are the same. We'll hear from the DOs themselves as well as their patients. But first, let's see the responses of patients awaiting in one DO's office to the question, do you know the difference between an MD and a DO?
I assume that a DO is a specialist.
Not really.
It's slightly less medical training. The schooling is a little shorter.
And the MD is a medical doctor.
Okay.
I don't know what the DO is for.
Not exactly. One's a medical doctor and one's a doctor of osteopathy. But what the extent is, I don't know.
I really don't know.
No.
Oh, no, I don't have the slightest idea at all.
First begun by an MD, Dr. Andrew Still, in the 1860s, it has only been in the last 20 or 30 years that osteopathy has become more common. Osteopathy combines the practice of holistic medicine along with manipulation.
Traditionally, the osteopathic approach to the practice of medicine has been one of holistic medicine. They believe in treating the whole person. They aren't interested necessarily in treating an individual entity like, say, diabetes or heart disease or something, but you treat the person who might have diabetes, who might have some other problem, and frequently disease states will cut across different kinds of problem areas. The other thing that I would say is that from its very inception, some of the fundamental philosophy of osteopathy dealt with working with the musculoskeletal system of the body. The muscles, the bones. 60 to 70% of every person's body is made up of muscles, bones, and nerves. It's called the neuromusculoskeletal system. Some physiologists refer to this as the primary mechanism of the body because it's the thing that's most responsible for our being able to do everything that we do. Walking, eating, just everything that we do involves muscles and their actions, the system of levers that we use. And it's an area of great neglect, and it always has been in the practice of medicine. The muscles have been regarded by most, or let's say many people, as just kind of a covering, something that's in the way of the important stuff, the vital organs like the heart and the liver and the stomach. And from the very beginning, the osteopathic approach has been to treat the muscles and the bones just as they would treat any other part of the body.
The additional training in manipulation is the key factor distinguishing an osteopathic physician from a medical physician. Training is essentially the same in other respects, according to Dr. Dwayne Harper, Regional Dean of the Ohio University College of Osteopathic Medicine.
The third-year training program is a 36-week program, and during that 36 weeks they're here at Doctor's Hospital here in Columbus on a program which involves basically three parts. The first part is a formal lecture series which is here on this schedule. This is 100 hours of formal lectures that are given by our local clinical faculty. In addition to that, there are seminars. These are, again, formal training programs that are taught by the clinical faculty here at the hospital. The major part of the program is spent in actual clinical service rotations, where the students will spend perhaps 15 weeks in a department, such as internal medicine, or 6 weeks in pediatrics, etc. The curriculum for the third years is developed to produce physicians who are oriented toward family medicine, and the emphasis is basically on such things as family medicine, internal medicine, pediatrics, and that particular area.
About 70% of DOs become family practitioners. The other 30% specialize, for example, in surgery or pediatrics. Students I talked with seem to have very definite reasons for choosing osteopathy.
I do want to go into family medicine and using principles of preventive medicine, and I believe that osteopathy allows me to approach my patient holistically and in a more personal approach.
Well, I've been provided with a good role model in that my father's a DO, and also I've had the opportunity to work in a DO hospital for 5 years, and I've been pleased with the way that I've seen the patients handled.
I was a pharmacist for 6 years and knew very little bit about osteopathy. Where I practiced, I was next door to a DO physician, and I saw he provided services that I thought were rather unique.
I worked at Doctor's Hospital for 4 years before I started medical school, and before I started work here, I knew nothing about osteopaths. The more I worked here, the more I respected them, the more I learned about the holistic approach.
Well, I've always been interested in going into family practice and felt that osteopathic medicine would provide a good educational basis to accomplish that goal.
The personal approach, the emotional supportive type attitude of DOs in comparison to MDs was very, interesting to me.
Dr. Seldon Nelson is a former pharmacist who is now a DO, limiting his practice to manipulation.
I treat the soft tissue problems that I find. If it means getting somebody in a position so that those tissues can relax and can resolve within themselves. The body has a remarkable mechanism within it of adjusting to situations if it's given the opportunity to do this. And a person can have a spasm in some area that's maintained for long periods of time. I mean, I've treated people with spasms that have persisted for 15, 20, 25 years in some cases following some insult. And they have the capacity that if you can get those tissues so they can totally relax, so they can be just absolutely in a relaxed, limp position for that particular muscle group that's in spasm, that whole mechanism of spasm will just relax and just go away.
So from what you're saying, though, how do you differ from, say, a chiropractor?
The main thing that I think that we differ on, I think the techniques that I use and that other osteopaths that manipulate use are somewhat different because I treat a lot of soft tissue. I think, as I understand it, most chiropractors will treat using thrusting techniques and adjusting the backbone and this sort of thing. When this is necessary, I do this also, but I put more emphasis upon the soft tissues. As an osteopath, I'm a fully licensed physician. I can use medications as they are indicated and needed, and I do this as an adjunct to the manipulation that I perform when it's indicated.
Some patients were in considerable discomfort prior to their initial visit with Dr. Nelson. PUCO employee Elza Fedor had a whiplash from an automobile accident.
It was after I had some treatment with drugs and so forth. My doctor realized that I wasn't getting any better, so he suggested that I get some treatment from Dr. Nelson.
Okay, we're just going to work with these tissues in the back of your neck and the back of your shoulder area just to help free things up, just to loosen things up a little bit.
Oh, good, because it does seem tight.
Seems to be a little tighter on the left than on the right.
That's right, it hurts more on the left, too. I was in great pain when I went to him, and I'm able to function now.
Jean Baughman had had open heart surgery.
Well, it interfered with a lot of things. It hurt.
Okay.
It hurt to move, it hurt to stretch my arm. Doing something simple like even putting down a pan of water for the dogs, I'd yelp. It hurt to drive a car. Anything that I'd be using my right arm, my right hand for. What he did was stretch muscles. I had to have, like maybe I think altogether about 5 treatments.
Okay, I'm going to work with these tissues, try to just mechanically move these tissues using this percussion vibrator that we have. And I just want to help increase circulation. I just want to help free things up around this cuff area of your shoulder. So just let me work with this just for a minute. It makes a little bit of noise, but it'll help us accomplish what we need to get done.
Only 23, Chris Sinise, a printer for Sinise Services, had a combination of problems from contact sports and recent car accidents.
I've been to a lot of doctors, and both MD and DO, and they gave me drugs. I took injections in almost about every joint in my body, like cortisone and lidocaine, and from both, and they put me on different kind of like a muscle relaxer and this kind of stuff. And at first, like right at first, I got somewhat relief, but you know the pain was just getting worse and worse, and because it'd been for so long, you know, I myself wasn't even noticing, you know, more and more. It wasn't until now, it's almost about half a year later, that he's worked on me that I can really see, you know, how bad I was, because I feel so much better now. The treatment took about an hour, and it was very gentle. It wasn't, you know, any kind of somebody in there twisting your head off or anything like that at all.
Stockbroker Ed Thomas has his own farm and is frequently on the tractor, which led to the common problem of tennis elbow.
And I noticed one day when I was driving the tractor that my left arm was hurting quite a bit from driving the tractor. But I thought, geez, maybe all of this is not what it's supposed to be. And so I called up my old osteopath up in Cleveland, and he said, well, why don't you go over to Doctor's Hospital? And he said, they have an excellent team of osteopaths over there, and maybe they can get you somebody that can do some manipulation work. So through him, I got to Dr. Nelson. And I think Dr. Nelson's classic statement was, you know, I wish some of the doctors would look for horses instead of zebras all the time. And so he started working on my arm, and it helped it tremendously. You know, it's very gentle. His specific treatment, his method of doing it specifically, and just getting to the specific aches and pains. And the first time he manipulated me, it really amazed me, because I couldn't believe that would solve the problem as fast as it did, that it could be solved just almost instantaneously.
CODA personnel director Glenna Watson had experienced back pain for nearly 6 years.
From 73 until 78, I'm sorry, because it was in December of 78 when I met Dr. Nelson. I had gone through life feeling that I had a slip disc, assuming I had a slip disc, and periodically I would have attack of muscle spasms, either from fatigue or stress or whatever. Mm-hmm. So in December of 78, this occurred again, the muscle spasms, and I'd bent over one day to pick something up out of the cupboard and couldn't get back up. It felt almost as if he was kneading, as you do dough, up and down my back in the areas that were affected. One of the things that always amazes me is that he can go right to the spot wherever the muscle is. Sometimes I can't tell myself. All I know is that there is pain. And then he hits a certain area, and he said, you know, he says, is this where it is? And I'll say yes. And then he goes through the exercises. Sometimes he almost pulls out the kinks, it seems.
Jack Christopher had been plagued by agonizing headaches.
But it seems like there might be pressure on my nerves along different parts of my body where I've maybe injured it while I was a child or even later on in life. And those pressure points cause my headaches, which I've had since 71. He's the first doctor who has made any kind of impact at all on my headaches.
For those patients, manipulation helped and made their lives better. This is not to say it is a cure-all. Dr. Nelson explains there have, of course, been failures.
Anybody practicing medicine has failures.
Can you just give us an example?
Yeah. And a very nice lady who had an accident falling, and she fell partially under a car on the ice, and she twisted her back in a process we call a torsion, where the sacrum of the spine, and I can maybe show this on a screen since you mentioned this. The sacrum lies between the iliac crests here, and it normally is perfectly functional with straight up and down, as if you were looking at this on a up and down cross type thing. Well, the sacrum sometimes can get twisted, and it can get locked in that twisted position, and this sort of a situation then causes pressure on some of the nerves that come around, and can cause all kinds of difficulties. And I treated her several times. Each time she would get a great deal of relief, but then she would do something at home that it would go back out, and she'd be in a great deal of pain again.
Dr. Richard Costin is a DO who is a surgeon. He is one of the 30% of DOs who specialize.
I don't personally give manipulation, no. I do have use for it in my patients, and when my patients do need it, why I have it administered by one of the doctors in the hospital who is trained in this.
What does a routine day consist of for you?
Oh, for the most part, making hospital rounds, visiting patients early in the morning, and doing surgical cases, and then examining patients that have had surgery and examining new patients that may need surgery in the afternoons. And then finally in the evenings going back and saying the final goodbye to the patients for the evening. In my case, it's 2 or 3 hours a day that is involved in visiting with patients. Did Dr. Nelson get him to treat you yesterday or today? It was not a cancer.
That's very wonderful news.
Okay, you can go home day after tomorrow. Most of my patients obviously are surgical patients. Some are being prepared for surgery, so this entails ordering tests for them, looking at the results of tests that have been done. And those patients who have had surgery, it involves checking their incisions, checking them to be sure that they are responding and recovering as they should following surgery.
In addition to being the regional dean of the Ohio University College of Osteopathic Medicine, Dr. Harper is also a pediatrician. Internist Dr. Ruth Purdy decided to become a DO when she needed the assistance of one herself.
And so when I went to college, I was going to be an MD. I went out playing golf one afternoon, and I got hit in the elbow with a golf ball. And I went to the orthopedic physicians, and I was given the pain tablets and so forth, and my elbow still hurt, and I had difficulty moving my arm. And so one of my friends said, "Why don't you go to an osteopathic physician?" So I went to this osteopathic physician who manipulated my arm and who took away the pain without the pain pills.
It has only been recently that the medical profession has accepted DOs.
I think it's competition. We're all sort of more or less caring for the same general patient public, and as the health care of the country is improving, there's less demand maybe for medications and health delivery. We are also gaining recognition throughout the country in that we have full practice rights in all 50 states.
The DO is in our Columbus area, I think thought very much of as a fellow or a brother professional, and there is a lot of interaction, a referral, and hospital staff conferring in regard to the MD hospitals.